Yeah, listen very well. I was requesting people who are sitting up on the chair to sit really on the chair because in case they didn't just come here, we look at us as we are very disorganized. And as medical student, I request you to be very, very disciplined because that is your paper. Number one is discipline. If you do not discipline, you may not finish medical school, I swear. This is very serious. Please do that for your own sake. So let's welcome him. I'm giving him 10 minutes. Catheterization, why I'm giving him 10 minutes? Because one, the patient is pain, you don't need to take 20 minutes. The patient will die of pain. Anesthesists are here. Even if you are sleeping, you can still feel the pain. So I'm giving him 10 minutes. 7 minutes is for catheterization. 1 minute is for taking temperature. Is that the time you're done with that?
Yes.
1 minute.
I'm going to try as much as possible to make sure that I get this time.
Thank you.
Okay,
Because we have lecture. Like me, I'm already off lecture right now, even Stewart. So think for us.
Okay, thank you. So, I'm called Yawagam Gordon, and I'm a nursing student, as you can see. You can see me in this room. I'm proud of that. Yeah. So, besides that, I'm the vice president of ANSCAP, the Nurses Association. I think most of us here know about it. So I'm going to do catheterization, and as you've heard, I'm going to do it very rapidly. You are going to project for me?
He's there.
Okay. Thank you. So you can go ahead and project. Go to the next slide. So this catheterization, it's a sterile procedure that is done to patients whereby a fine plastic or rubber tube called a catheter is inserted into the urethra of the patient. So we have two types of catheters. We have metallics and the rubber catheters, like these ones. And we as well has two-way catheters and three-way catheters. I've managed to get a two-way catheter which has two tubes, but there are three-way catheters that has three tubes. The catheters are of various sizes, as you can see from there. You can go to the next slide. I want to summarize. So, indications for catheterization. When is this catheterization done? When are you supposed to do catheterization? One, when you are collecting a urine sample and you happen to tell a patient and he fails to urinate, you will be forced as an immediate healthcare provider to pass a urinary catheter and you obtain a urine sample. The next one is when you are to relieve retention of urine. In most cases, most especially where you find that the patient is having like benign prostate hypertrophy, whereby that hyperplasia of the prostate blocks urine from being released from the blood. You will be forced to use this catheter to relieve the patient. When you are emptying the blood before doing the pelvic and abdominal surgeries, when you are going to do some operational procedures, most especially in this part, or else you are doing any surgical operation that needs general anesthesia, you will be forced to do catheterization. Then when you are going to empty the blood before carrying out blood irrigation. Blood irrigation is another procedure which is done when you've gotten an operation of the bladder. For example, you have cysts in the bladder and they have operated you, they have removed them. Prevent infection of those wounds which they have put in the urinary bladder shall be required to always do this bladder irrigation process. So before doing it, you first untie the bladder, and then you continue the bladder irrigation using a three-way catheter. Then when you're sprinting the urethra following the urethral surgery, there are some advanced operations of the urethra by specialists, urologists, which can involve splinting the urethra in case there is a trauma, there is a rupture. So before doing that, you will need to carry out sterilization. Then, in cases of urinary incontinence, for example, in patients who are unconscious, shall be needed to do this sterilization. So, care of an wearing catheter. When a patient is having that catheter, for example, it is meant to stay there for 3 or 4 days or 1 week. How do you care for that catheter? One, we hang the urine bag. We hang the urine bag to a raised point. If this is our bed, I will need to take this when I'm doing the bed. If this is our bed, we are not supposed to leave the catheter hanging down. No, we are supposed to hang it at a raised level, like here at the bed, prevent infections from passing through that catheter up to the blood. So we can as well clean the catheter tube always. I will also demonstrate this. Then we need to always also clean the grand space solar bed to enjoy the restaurant. Complications, if not cared for or placed inappropriately. One, we can have rupture of the urethra. So, suppose you are an incompetent catheter, or anyway, it is your first time to do catheterization on the patient, and you happen to forget and to take the tip of the catheter at once. You may end up rupturing the urethra, or else when you use a larger set, you may end up rupturing the urethra. That is one thing. Two, you may have catheter associated urinary tract infections, which may cause epididymitis, otitis, and inflammation of the prostate. This epididymitis, it's the inflammation of the epididymis, and it is usually an indication that the epidermis has been attacked by some fungi or bacteria. Then otitis, it's the inflammation of the testes, maybe one or four of them. Then inflammation of the prostate, prostatitis. Those are some of the complications. So, requirements. What do you require when you're going to perform this procedure? One, yes. So, one, you have to be having no trolley. This one, we call it a trolley. Those ones who have not seen it, or we don't know its name, we call it a trolley. Then we have our patients here. We have a screen, which we shall use to provide privacy. And our trolley is having both a door and the bottom shelf. So this is what this is what we are supposed to be having. But the fact that we are running here, I have not managed to get all that is indicated. But this is what we are here supposed to be having. This is what we are prepared. And I'm prepared when you are not here, but you are supposed to be having these skills of preparing it in order to prevent infections, as it is our first goal. So this is our patient. Once you have prepared your trolley, it is like this. And the fact that it's a sterile procedure, you have to make sure you don't make the patient suffer from any bacteria or internal infection. So you must make sure that you maintain the procedure sterile. That's why you are seeing my contents. I have this bottom cloth and this top cloth. Before preparing all this, I first clean my trolley. That's the first thing you should do. And when you are cleaning the trolley, you just get your swabs, the swabs say of cotton. You wet them using an antiseptic, then you clean the trolley from the furthest to the nearest point. You be doing like this, clean like this, like this. Then after that, you put the bottom cloth. Then after putting the bottom cloth, you come and put your instruments. So the instruments I have the gall pots. These are the gall pots. We call them the gall pots. These gall pots are having cotton, and it is the one I want to use as my swab. So I have hidden dishes. And these hidden dishes, I want to use them as receivers. So I have my catheter, I've already showed it to you. It is a two-way catheter. I have a urine bag. It is what I want to connect to the catheter. I have water of injection. This one is distilled water, but it is special. It is the one we use for injecting. In case you want to, for example, to open the cannula which was blocked by the other throat. However, it is not indicated. From what one of us has told us, it is not indicated. But in case you want to open it, use this one. It is sterile. Then I brought this to use it
as a gateway, lubricant.
Yes, as a lubricant, as a KYJ. So, when you're doing this procedure, you should be having a KYJ or any other lubricant that you will use first to lubricate the tip so that you don't rupture the what? The vessel. So, this was my top shelf. Because I'm going to eat breakfast. So we go to the bottom shelf. The bottom shelf is having instruments. Yes, they are sterile, but the most sterile one is the top shelf. So the bottom shelf is having a towel, this is the towel I'm talking about. This is a Macintosh. The Macintosh. A drop Macintosh. Then I have my rod. All of this shall be used. I have a 10 ml syringe together with its syringe. Yeah, 10 ml syringe. I have a sterile glove. And I have
Fluid charts.
Yes, I have a fluid balance chart where I will quote any urine, for example, the first urine that comes. Anyway, we will quote urine that comes in that. So I go to the procedure. I will ask you, Mr. Christopher, the judge, to be my assistant. The You're going to be my assistant.
And I have a question. What do you mean the assistant?
This one being a sterile procedure, most especially when you're being alone, you may end up making mistakes. You transfer the other bacteria, the Pseudomonas aeruginosa, those other microbes, you transfer them to the patient because of the mistakes you made. But when you'll be telling the assistant to help you, facilitate you, in such doing, you may reduce that mistakes done. So, I told you I'm going to use this one as a real patient. I'm going to assume that now I'm on ward. So I'm going to, which should I use? Let me use John because it's the manager. Aha. So, good morning, Mr. John.
Morning, how are you?
I'm called Nurse Gordon. And I would like to put urinary catheter in you to help you urinate well. Would you allow me to do it?
Yes.
Okay, thank you. So the patient has, I've gained consent from the patient. So what I'm going to do, I'm going to first put on my headphone. Easy.
If you are not sterile, you can put on, then you start your procedure. But if you are sterile, you ask somebody to put for you, okay? But also not to waste time. You are supposed to screen the bed, because now you are dressing, the bed should be screened.
No, because one of them was.
Okay, you
But
tell them.
you would still explain to us that for privacy.
So, this patient, let's say we are screening now. You are not there. You are screening. Is it okay?
Yeah.
Yeah.
Because I was over speeding,
Mm.
so
Yeah.
I may jump
It's
some
okay.
things. But you're not supposed to touch on the patient when you have not secured what? Privacy.
Thank you.
Even if it is this mere correlation, the patient may not want the immediate patient to know what you are doing on that patient. So you secure privacy.
You need disposable.
Yes.
Yeah.
I think. And we assume your assistant has the glove,
I assume Mr. Priest is having the gloves.
apron, and everything.
Aha. So I will first put on these gloves, the disposable gloves, and first assess my patient. Assessment means you are going to first check. So you are going to first check and prepare the patient very well. So I will expose only the parts I want to work upon. This time I want to work upon the very parts. I see my patient. Yes, he's okay. He's an old man. He's not circumcised. So, and I've prepared everything is there. So what I'm going to do, I've finished assessing my patient. I'm going to drop away these gloves. I'm going to discard them.
They're supposed to wear first.
I don't know how to pass.
What about the man?
The Macintosh is already there.
Oh, yeah.
Yes.
Tell us that.
Anyway, also the position of the patient, you raise the legs. Like,
Lobotomy.
But they should stop overspeeding.
It is okay. It's
You
okay.
are right.
It's
Actually.
okay.
I should really stop overspeeding.
But the position doesn't matter. If like that was is okay, it exposes the organ there. No. If it is a woman, then you need the little.
Okay.
Or the dorsal with the flex. Like,
So when you are assessing the patient, after seeing that the things are okay, although he's circumcised or not, what you do, you come and put the drum against and the towel below him, so that when you put the catheter, the other one doesn't drop where on the bed. So those ones we came when they were already prepared. Yes. After doing that, you will have positioned the patient very well. So for this case, we can access the genitalia very well. So we may not tamper with our patient. So I already assume that my assistant has gloves. What I'm going to do is to open my sterile shelf.
so
And
you
this
can
sterile-
hold this cell or top trolley or down cell.
And
or
this
down.
sterile environment, as I told you, it has to remain sterile. If I was having the cheeto fossil, I'm sorry I've left it. I would have used it to open up the what? This top shelf. I would have touched like this. Again, I begin from the farthest point,
Yeah.
so that I don't, disinfect my things. Then I expose them like this. This glove was supposed to be on the sterile shelf, but unfortunately.
No, it's okay because you didn't open.
So, now, because I have opened it, I've prepared my patient, the next following step is to put on
Sterile
glove.
Also observe very well how they put on sterile gloves. That's a procedure by the way.
So, I will have open it slowly. In this case, let me use here, but I'm not supposed to use here.
When you want to open the glass, there is an arrow. When you open, so your trolley is sterile.
Yes.
Just open
And drop it
Let it
right
drop.
the sterile environment minus touching it. Because when you touch it, you may end up doing what? Infecting it. So, since you have prepared it and finished, I'm going to first wash my hands. Make sure that I eliminate anything. In this case, I'm going to use sanitizer. And put on my gloves without touching them. So there are two gloves. There's a left hand glove and a right hand glove. So what I do, I will not touch. Anyway, it is like this. So what I do, I will not touch on this outside part. When I'm wearing it, I will just put in my hands like this. You see? So after putting in this, the fact that the one which has remained there is still sterile, I shall hold it using the sterile part and then I use this sterile part to wear this one very well. But sometimes you may not put it in perfectly, but what you have to focus on is to make sure you don't touch on the sterile part. So because this one is still sterile, this one is sterile, now I use it to fit it in very well. I have not touched outside, and therefore I think I'm sterile. So now, my assistant, you are going to help me make the swabs. Yes, the cotton swabs. You are going to use a disinfectant.
But wait, this environment is for you. I'm supposed to give you what is down.
Exactly.
Yes.
So, these swabs, I would have prepared them earlier.
Yeah, you can
Because
use that.
my assistant may be having his dirtiness. I don't want him to dirten my what? So I assume these ones I prepared them at
So
first.
this one is ready.
So now I shall pick them by myself. Come clean the pins glands of the patient. After doing that, I will drop it.
You see it there.
I will drop it
He has the receiver here.
in a receiver that is receiving used swabs. And that receiver should be on the bottom shelf, not on the top shelf. I clean. I hope now my patient's glands pins is now clean. So I hold it firmly. I hold the pins firmly and upright, and I get my urinary catheter. Mr. Assistant.
Yes, even
So-
if you don't put it okay.
So, before putting
Yes.
this catheter,
Yes, sure.
I told you I need to first lubricate it. Because if I don't do that, I'm in position to injure the urethra. So, I will hold my gauze. This one is called gauze, and is sterile. So, after he has put his gauze, I come
Lubricate.
and lubricate the head of my catheter, the tip of my catheter. Then, my assistant, I need to receive head.
I'm not supposed to touch it.
Yes. So I'm holding it firmly upright. I have lubricated my catheter. So I push in. As I'm pushing in, I'm talking to my
You took
patient.
the patient, to
John,
get his psychology.
John, how are you?
I'm good, but I'm feeling pain, prisoners. I'm feeling pain.
Oh, sorry. The pain is for a short time.
Okay.
You are going to be relieved.
But now, somehow, will I be okay?
Yes, you are going to be okay.
Okay, thank you.
Now, John, I am done. I have finished. So, I've pushed it and has reached there, and an indication that it has reached in the urinary bladder is that I have seen a flowback of urine. So, after seeing the flowback of urine, I allow it to flow in this receiver. Get? And after seeing that first flowback, those first drops, I push it further so that it reaches directly in the bladder. So, my assistant, I need water for. Now, what is remaining?
What about
Since it has reached there, I now need water for ballooning. And the water I'm going to use, which is non-infected. Which is non-infected is the other one that is distilled.
Yeah, don't know. Just go there.
So I'm going to ask my assistant to draw 15 mils or 20 mils. Usually I'm using 20 mils. And then after giving me that, I will use it to balloon this cassette from this other tube. Are you getting it? We have two tubes. We have this one which broke the urine. I have this one which we shall use to balloon in order to make the catheter get fixed exactly in where? In the urinary bladder, so it doesn't come out. You see how he withdraws? If you are not serious, you may end up pricking yourself. Actually,
You need how much?
I need 15 mils. It is not you.
Great.
We can use that as a demonstration.
So I now balloon my catheter. Balloon? Oh, sorry, it had not got fixed. Now imagine you are doing this to the patient. So you first push it. You have to push it firmly, and after pushing it firmly, you now push this water to go and balloon and secure the catheter from the urinary bladder. So, after doing that, now you have ballooned it, you are done. What is remaining is to get the urinary bag and you connect it to the catheter. So it is made in a way that can get fixed firmly in the catheter. So you fix it like this and you hang your urine bag at a raised point. Avoid what? Catheter associated urinary tract infections. So after hanging it, you ask the assistant to bring you the strapping, because you will now secure this catheter on the inner part of the side. So you get your gauze like this, and you ask the assistant to give you the strapping, you secure it from here. The reason as to why we use this strapping, that this gauze to hold it at first, is that some patients have some allergic reactions to the catheter, so may not make them comfortable. So you hold it using the gauze and then you secure it. So you have secured your catheter, you are done. You remove the other receiver that had urine and you put it on the bottom shelf. Then you cover the patient again. And you sank the patient. John, I have finished. Thank you for your cooperation. How are you feeling now?
Fine.
Okay. I promise we are going to work upon your issue and we will define it. Here, you're done with the procedure, and what you will do, you will have to remove and discard this drugs. You are done with the procedure and you will be successful. You are not going to remove it.
But a question, before removing, how do I get it?
When this hearing part, so you keep on watching it. When it gets just pull that on. Just don't pull it out.
It's just this part, the way I pull, another it goes like this. Just it goes like this. After finishing, press back.
And somehow it's just.
Yeah. That's all.
And then you follow the unit, you make this bucket or this. So yeah, then it's all
Let's give it some 1 minute to submit.
I think let's do the last part that we talked about is removing the catheter. Doctor or someone else can remove the catheter from that patient. Just not one, two. You need to recall how much water did you use during balloon. You go within your sterile environment. You put out,
You withdraw.
withdraw. That's 25 or 20 or 15. After withdrawing it out, there you can pull slowly by slowly. Otherwise, if you pull before withdrawing, you cause what? Urethral rupture and bleeding and then PCD, which will not be good for the patient. That's the only thing I want to add on. Then another thing I want to add on is, as I said, the procedure is so sterile. If you do it in an sterile environment, you cause infections. There are diseases there that have come out because of catheterization, bronchitis, lower inflammation. So you must do it in an sterile environment. Therefore, you need an assistant. Never you do a sterile environment without an assistant. And never shall an assistant tell you what to do. That's why I was so quiet. He was asking me what to do. An assistant shouldn't tell you what to do. If it is an exam, an assistant says, hey, you have forgotten this. That's reduction on what? On your marks. So an assistant should keep quiet. That's all. Thank you.
Okay, thank you very much. Now, I assume that I again come with my sterile glove. I want to remove the cassette. So what I will do, I will again beat the patient, tell him what I'm going to do, and gently expose his area.
Aspirated.
I first assess.
Just show it there.
So
It's
after
here.
assessing, I get my syringe. I will have come prepared with it. So I now withdraw the other water of injection that I pumped. So after withdrawing, now it means it is free to come out. Yes. So I will again hold it and I remove. So after that, I discard this and then send to the patient, leave him, come back.
Let's give it a hand.
Maybe a little demonstration. What I was doing when I was ballooning, so when you have pushed this cassette and it has fully reached in the urinary bladder, what I was doing, what I was calling ballooning, is that when you push this water, this cassine, this balloon gets
Now
ballooned
you
with
see,
water.
those are on WhatsApp.
So after getting ballooned with water, it means it is now secure, it is firm inside the what? In the bladder, and therefore it can't
Come out.
Never do it when you are in urethral, please. You rupture the urethra. You must make sure you are in the urinary bladder before you balloon.
Okay. Then when I was removing it, I said I'm ballooning, I'm withdrawing. So, oh, sorry. So this is what I was doing.
Leave it out. Okay. The other is not what?
I can also use this. So I said I'm burning or withdrawing the other one.
You use this one. Use this one. Not good. You buy another.
I said that I was burning. So now I'm assuming it is still inside
Yeah.
the urinary bladder. When I'm burning, when I do this, I remove what I had injected, I had put. So now it becomes free.
Thank you. As we welcome the anesthesia students to present for us something great, let's give hand clap to the nursing students. And this procedure is not only for the nurses. Cut across, whether you're a doctor, anesthetist, nurse, and then also more so you don't put the antiseptic on top of the trolley. And also, in other cases, you must have a lavatory face foam and a specimen bottle. In case. Then also a measuring jar. Yeah, a measuring jar in case you want to measure the amount of urine. Actually, you're very well.
They were in the presentation.
All right. So, my brothers from anesthesia department, this is most critical area in medicine. You a doctor, you do work without knowing what is happening with the patient, but the anesthetist knows what is happening with the patient. So I welcome these big men to present for us. Let's just give them some few minutes and then we wrap up with use of condom. Don't leave before knowing use of condom. Most of you are from A level, you have been using condom inappropriately. So you will look how risky you were misbehaving with the condom today. Then you will go and use it the right way. So don't move away. We are almost ending. I know this is a senior case. I will give them 10 minutes. But I will add for them some minutes because if they are, I don't know, they will work against that time.
Good afternoon. I'm Claude in the year I'm an anesthesia student. My final semester. Don't mind about my English. I studied English in senior in secondary school, but I studied French one. I studied Rwanda 5 years. Okay? So, we're going to talk about spinal anesthesia. Anybody knows about spinal anesthesia? Mine is more practical. Spinal anesthesia may be called umbilical block, subaqueous block, spinal block. Another one? Okay. So it's where you get your drug, small dose, titrated dose. Of course, you titrate milligrams per kilogram. And we use the people care. Strictly, it is this one. It is in 2.5 milligrams per kg, and it depends for pregnant mother and no person like me. They are different. Pregnant mothers use only 10 milligrams strictly. So you get your small dose of drug titrated, you put it in your syringe. In your syringe, you inject it in subcranial space. But before you go there, spinal anesthesia may be called local region anesthesia. Local region anesthesia, and it has very